CYC is a free channel, presents the Word of God for everyone. Your support will help us to continue the mission. Visit our website, cycnow.com. Even $1 will make a difference.
Hello, and welcome back to our second season of CYC MD. Previously, if you recall, we met with various healthcare providers and professionals, all of whom gave us insights into their careers as well as their schools and education. In this new and exciting season, we are going to indulge and focus and dig deeper into different areas of expertise. With me today, I'd like to re-welcome Dr. Amgad Makarios. Welcome, Doctor. Pleasure to have you again.
Thank you.
I know schedules have been a little tough, but it's good to have you again.
Glad.
Who is our chief cardiologist at Nassau University Medical Center. So last season, I'm going to just remind the viewers what we talked about and what you enlightened me about. So we talked about blood pressure, and we said blood pressure is the amount of pressure within blood vessels, right? The amount of pressure within the blood vessels. And we also said that high blood pressure can lead to different things such as heart attacks, strokes, and heart, and even possibly kidney failure. And we touched over normal values, but I'm going to ask you to just revisit that, and if you can tell us again, what were the normal blood pressure values for adolescents as well as the elderly?
Okay, so that's a very important thing to keep in mind. And the usual numbers that we talk about the upper number and the lower number.
Yes.
And this, just to make it very simple for everybody, the heart contracts, which means it squeezes the blood, and then it relaxes, it fills with blood. So when it contracts, there's a certain amount of pressure that the heart generates within the blood vessels, and that's what we measure, and that's the upper number, the systolic number. Then we talk about the heart relaxing, and when the heart relaxes, that's when the blood starts to fill the heart, and that's where the actual lower number is generated, and that number is always lower. It's lower than when the heart is relaxing, than the upper number. So that's the diastolic number. So that's what we talk about when we measure the blood pressures. And we can measure this blood pressure by actually measuring the pressure within the blood vessels in the arm by inflating a cuff higher than the upper number and then decreasing the amount of pressure within that cuff to lower than your lower blood pressure, and that's how we get our numbers. And we measure it in millimeters of mercury, which is basically the unit that we use to measure the blood pressure. So that's how we measure the blood pressure itself, and that gives you a reading for how much pressure is within the blood vessels.
Mm-hmm. So what are the normal values?
So the normal numbers, I actually brought a chart here for everybody so we can take a look, but last time, if you recall, we talked about blood pressures of 120/80 being as normal numbers. But if you look at this actual chart here, it's good to actually keep in mind some of the numbers. 120/80 is excellent. That's the normal range. But then we talk about, and what some people call pre-hypertension. So once you start getting above 120, even 120 to 129, as you can see here, and 80 to 85 on the lower number, that's called pre-hypertension. That's where you have to start worrying and paying attention to your blood pressure. And then we break it up into different stages. And the really, to be defined as hypertension, high blood pressure, you have to be above 140/90. Okay, so those are the cutoffs. And then we stage it in different ways where we can determine how bad the high blood pressure is or the hypertension. So stage 3 is a really bad, that's greater than 180/110. So the general numbers to keep in mind, 120/80 is a good range, anything 120/80 or less. If you start getting above 140/90, then you're in the hypertension range. Anything in between, you have to start worrying also and pay attention because you could be moving on to the high blood pressure ranges.
Okay, so is a 120/80, we'll say, is like a flat range for adolescents and elderly, or sometimes people say as people get older, they, it goes up a little and it's still considered normal?
Right, so as people get older, it's almost a natural progression where the arteries harden to a certain degree. So if the artery, which is what we're really measuring the pressure within, hardens somewhat, as it does in a lot of elderly, whether there's calcification or thickening of the wall, then your blood pressure can go up to a certain degree. However, once you still start getting up to the 140/90, it's still not good to keep people in that range. So we might maybe allow them to get up to 130, 130/85, something of that sort. But in general, it's still a good idea not to let it get much higher than 140/90.
Okay. And you did mention in the way to measure blood pressure is you use the cuff. And I want to tell our viewers to stay put till the end of the show because you will be doing a demonstration on me. And hopefully I have good blood pressure. So what are some risk factors for high blood pressure, or what are some causes for high blood pressure?
So some of the causes are really a lot of the things that we can control. So increased salt in the diet, obesity, all of those things can contribute to high blood pressure. Now, obesity, we talk about high cholesterol and everything else, and we all get that image of the person with the big fat belly, and that's an issue. Well, the reason why that big belly is a problem is actually the fat that builds up in your stomach area. It's called the omentum. It's that part inside the abdomen where all that fat builds up, can actually squeeze the kidneys and make the kidneys think that there's an issue going on, and that can thereby raise your blood pressure, because we all know that the kidneys very closely control your blood pressure by holding on to fluid in the body or getting rid of that fluid. The other mechanism that we see is with the salt. If you increase the salt in your body, that holds on to water. So therefore, when water maintains within our blood vessels, that will increase your blood pressure as well. So all of these things in combination, other causes, things like heart disease itself can lead to high blood pressure. Other causes, primary causes with the heart, if you have an issue with your heart and your heart is pumping, increased pressure within your arteries, you can get increases in your blood pressure as well. But a lot of it is controlled by what we do with our body. Sedentary lifestyle can lead to obesity and therefore also lead to high blood pressure. So all of these things taken together can lead to increases in your blood pressure as causes of high blood pressure.
So how would I know without physically going to the doctor's office and getting my blood pressure checked, how would I know that I have high blood pressure?
Right. So first I'll say that everybody should get general physical exams, probably yearly, even if you're young or things like that. But if you don't, it's going to be very difficult to pick up high blood pressure because we sometimes call it a silent killer. Just like high blood pressure, we also call diabetes, high sugars, a silent killer because you might not feel it up front. As your blood pressure slowly progresses, people think, if my blood pressure is high, I'm going to feel it, I'm going to have a headache, or I'm going to have other things. But early on, as your blood pressure is slowly creeping up in those pre-hypertension ranges that I just showed you, you're not going to feel anything. Most of the time, you're going to feel fine. You're not going to feel any of the symptoms that we talk about when we talk about high blood pressure, and thereby you're going to miss actually doing something about an increased blood pressure. However, as the blood pressure starts getting really high, then you can start feeling symptoms of headaches. You can start feeling, chest pains. You can feel shortness of breath. You can feel flushing sensation. You feel warm, things of that sort. But that again, and I'm not advocating for somebody to wait for those symptoms to happen, because then at that point it might actually be a little too late for you to control the blood pressure. And all the bad things that high blood pressure does might actually have progressed at that point where you're not going to be able to help prevent it or fix it.
Mm-hmm. So what are other health-related issues or concerns that somebody with high blood pressure can develop?
Okay, so high blood pressure itself, just imagine if you have a pipe and you have pressure within that pipe is under increased pressure and the wall of that pipe is then under stress. So our arteries are like pipes. Think of them like, your usual plumbing. If you start increasing the pressure in there, you can get damage to the wall of those pipes, okay? And we talk about the cells, we call them endothelial cells within the wall of the artery. Those cells, when they see this increased pressure, can get damaged. And all the things that they do, we know that the arteries and the blood vessels can dilate or relax or constrict. Once you start damaging those vessels with the increased blood pressure, you then will damage their ability to do that. Once you do that, the body sees it and tries to repair that. So you start getting plaques. Obesity also plays into this. Atherosclerosis starts to develop from high cholesterol and things like that, and you start getting damage to the walls. When you get damage to the walls, you then start worrying about whether or not those vessels will be able to do what they need to do. And as you build plaques in there, the blood pressure gets even, with more increased blood pressure, you can get damage from those plaques. Those plaques can rupture, and if they close off the blood vessel, then whatever muscle, or if it's in the heart, then you can have a heart attack, and all those kinds of things will happen. So that's why you have to watch out for the atherosclerosis. You can get strokes also if it happens in the brain. You can get damage to the blood vessels in the brain. You can get a stroke. And then, the worst thing is we talk about the aorta, which is the main artery in the body. As you get more and more high blood pressure combined with atherosclerosis or the plaques in the aorta, you can actually get rupture and aneurysms of the aorta. Mm. So all these are the things that can happen secondary to high blood pressure.
Mm. What about, would you say it also can affect like kidneys and kidney failure?
Of course, yep. So that's another important point. We know about people who have heart failure, kidney failure, who need to go on dialysis and things of that sort. Hypertension is one of the most common causes of people needing dialysis, which is a dialysis machine is a machine that basically takes the place of the kidney. We know the kidney gets rid of waste in the blood and everything when we urinate and gets rid of those wastes. If the kidney gets damaged from the high blood pressure, then the body won't be able to get rid of those.
So ultimately, we'll say if we visited our doctor, we could have started the preventative measures that can ultimately lead to things that can be almost fatal if you're talking about kidney failure and heart failure in that case. Mm-hmm. Okay, we're gonna stop for a short break, and we're gonna come back and we're gonna meet again, and we're gonna talk about drugs, treatments, side effects, and we're gonna also get my blood pressure tested. So stay put, we'll be right back. Welcome back, everyone. We're back with Dr. Emged Makarios. So we're just going to pick up from where we left off. And as far as treatment for hypertension goes and high blood pressure, I know as the drug market has so many different categories, classes, and so just a vast drug collection group. As a cardiologist, how do you know when different patients come and see you what drug is most appropriate for that specific patient with their condition?
Right, so this can be a very confusing part even for healthcare professionals because selecting the proper medication is not always the most obvious method to use. And there have been many trials that have actually looked at this, and the reason they've done that is because they're trying to figure out, it's not just decreasing the blood pressure, because all the medications can decrease the blood pressure, but certain medications have been found to work better, whether it's in men versus women or people of different cultural backgrounds or races. The selection process is not always the easy thing to do. Suffice it to say, the real important method is figuring out which is the right medication for the right patient and which is the medication that's going to bring your blood pressure into the range that you're looking for. So when we talk about the different categories, one of the first medications that most physicians reach for are the diuretics. So the diuretics, we talked about how one of the mechanisms of high blood pressure is the kidney holding on to too much fluid in the body with the salt and all of that. So the diuretics work on the kidney to help get rid of the salt and thereby the fluid in order to decrease your blood pressure. So one example would be Lasix. Everybody knows about Lasix or furosemide. That's the type of medication that will get rid of fluid, and that's why that makes you urinate more.
So don't take it at night.
Well, if you take it at night, if you're okay with waking up in the middle of the night, that's fine. But that's true. That's the type of medication that's going to make you run, and or if you take it during the day, make sure you have a bathroom nearby.
Accessible, yeah.
So diuretics are one of the first-line medications that we usually reach for. Then there are other medications that work on the heart. So there are medications called beta blockers. An example would be metoprolol or atenolol, those types of medications. And what these medications do is they slow down the heart rate. They actually work on receptors in the heart in order to decrease the heart rate. And by decreasing the heart rate, that also will thereby decrease the blood pressure, because heart rate is a component of the blood pressure. The faster your heart beats, the higher your blood pressure might become. So those are the beta blocker medications. Then we talk about other medications like ACE inhibitors. Now, when we talk about these medications have been found not only to lower the blood pressure, but also to be beneficial for the heart. So for example, people who have heart attacks, these medications have been found in many large studies to help prevent or improve the actual heart structure itself after a heart attack has taken place. These ACE inhibitors, however, have certain side effects. So ACE inhibitors might cause a dry productive type of cough where that's a side effect, and it's known because of the mechanism of this medication. So an example of an ACE inhibitor would be like ramipril and enalapril. These are the types of names, and as you notice, the different categories sound the same. So the ACE inhibitors end in IL, enalapril, ramipril, all the different.
And the beta blockers you mentioned before, metoprolol, atenolol. So kind of the easy way, it's easier way to group them together, and that's how you know this is the beta blocker group, this is the ACE inhibitor group.
Exactly.
So just to reiterate, beta blockers are the ones with the OL ending, and ACE inhibitors IL ending.
Right.
Okay.
And it's also helpful to look at the label on your prescription bottles, because those will sometimes tell you the indication or what the medication is for. So a lot of pharmacies are now printing that on there, which is very beneficial, because sometimes people have 3 or 4 medications that they're taking and it's hard to figure out what's what.
Right.
So the ACE inhibitors, because they have that side effect of the cough, newer similar type of medications, the ARBs or the angiotensin receptor blockers, were actually developed, and those medications tend to have less of this side effect. And you know, those are the types of things that we look at. So those are the general major categories. There's also the calcium channel blockers, which are also used. Calcium channel blockers, again, there are sort of 2 forms of calcium channel blockers, ones that work directly on the blood vessels and ones that work on the heart. So an example of a calcium channel blocker would be Norvasc. Okay? And the generic name of that is amlodipine. So we talk about, you know, the different types of categories of medications, and they'll sound similar also. Sometimes the different calcium channel blockers might have slightly different names because there are different sort of subcategories of them. So it's not always so easy to figure out based on the name what category it's in. But that's really the general. Now the important thing to keep in mind is also sometimes you might be on a combination of these medications, because sometimes one class of medication is not enough to bring the blood pressure down. And if it's not, then your doctor might actually prescribe multiple medications in different classes in order to get the desired effect in your blood pressure.
And actually, touching on the topic of combination medications, many drug companies have combined actually two different pills to make it into one pill for ease of convenience to patients. So sometimes they'll take, say, like an ARB, like a losartan, with a diuretic. Right. And so it'll be a combined one pill, but it has both the ARB and the diuretic effect. And that's also with other classes as well.
Right. This brings up a very important point, is compliance with your medications, adhering to the regimen that is prescribed, because you know you can be on the best medications in the world, but if you don't take them, your blood pressure is not going to help. So always, as much as possible, try to follow the instructions that are given to you by your doctor, or is, you know, pre-printed on the label. Always follow that. And what these combinations help to try to do is, a lot of people will get confused because they have this medication, that medication, taking this one in the morning, that one in the evening, and they get confused. So if you have one pill that combines the 2 in 1, they found that helps with the compliance of following the actual regimen of your medications.
I mean, you can't just take it one day, skip 2 days, and then say, well, my blood pressure, I took it once and it didn't affect my blood pressure.
Exactly. I hear that all the time. Yeah. I took an extra dose because I thought my blood pressure was high. Not always a good thing to do.
So how long would you say it would take for those medications to, you know, have its full effect?
Most of them, once you start taking them, they start affecting either the blood vessels or the heart fairly quickly. I mean, there's a certain, maybe a couple of hours here or there, but once you start taking them, and with blood pressure, it's not so much, you know, getting the blood pressure down today and then tomorrow it shoots back up again. It's the long-term effect. And we talked about, right, the damage to the blood vessels. That doesn't happen overnight. If your blood pressure is high one day and then the rest of your life it's normal, you're not going to damage the blood vessels, because like anything else, there's a progression. of the disease. So when you start taking a blood pressure medication, a lot of people say, well, I took the blood pressure medication, now my blood pressure is consistently normal. Well, guess what? You go off your medication, and most of the time it will go back up again. So that's what a lot of people sort of don't realize, and we'll talk about this when we talk about, in the cholesterol part. The reason why your cholesterol gets better when you take the medicine is because of the medicine. So as much as we want to get off the medications, at some point, a lot of the times we won't be able to. Some people, don't get me wrong, maybe you will be able to cut back on a medication or decrease it. But the reason we keep patients on these medications is because they need it for their blood pressure.
Now, briefly, every medication every medication has a side effect. So just overview, some side effects are not as severe, nothing to worry about at times, but overall, what would you say as the class of hypertension or blood pressure medications go? What are the main side effects? I know you mentioned for an ACE inhibitor, you get that persistent dry cough. So it's nothing that is deadly if you live with a persistent dry cough, but it's just things to keep in mind.
Mm-hmm. Yeah, so it's hard to give one overall, side effect to these medications because, as we mentioned, they're all so different. But to give an example, like for example, the diuretics, one, I wouldn't say side effect, but inconvenience is having to go to the bathroom all the time. So that's one side effect. A general side effect, I guess, if you will, is if you take too much of any of these medications, your blood pressure can go the other way and it can be low. And if your blood pressure is too low, you can pass out, you can
lightheadedness,
be lightheaded, be dizzy, all of these types of things. So that's a general, side effect of all these medications, since they all work to decrease the blood pressure in a different mechanism. But each one will have other side effects, and as you know, being a pharmacist, there's a list this big sometimes.
Yeah.
And, you can't predict always which patient is going to get which side effect. But if you follow the instructions, usually as best as possible, you will avoid some of the side effects either related to a really high dose or low doses and things of that nature.
So now that we talked about medication and treatment, I know a lot of people don't like taking medication and treatment and medications, but it depends what your range is, of course. But if you're not in that range yet where you have to take medication, what are some preventative lifestyle changes that if you're, borderline, you're approaching that and you want to change your lifestyle and you want to take some preventative measures to avoid being in that category of having to take medications, what would you say are some lifestyle changes that we can do?
Right. That's really the key, because everything in cardiology and actually everything in medicine these days has to do with prevention. It's always easier to prevent a bad process from happening, and this holds true for other things in life, not just your health. It's always easier to prevent a bad thing from happening than it is to deal with the bad thing once it happens. So the bad thing in this case is the high blood pressure, and you'll see recurring themes in terms of your health, but one of them is maintain an active lifestyle. So a lot of people will recommend at least doing some form of activity at least once a day, maybe for a half an hour, and sort of, as long as you're healthy and you don't have other contraindications, get your heart rate up. Make it a brisk walk. Make it something where you actually start to sweat a little bit. So an active lifestyle is one of the main things. Number two is what we put in our body. So diet is very important. Whether it's the amount of salt in your diet or actually the amount of fat or cholesterol in your diet, these are two main components. And then the third part is the amount of sugar in your diet, because the sugar will affect the diabetes. And as we know, diabetes is associated with high blood pressure and can, affect it in that way. Obesity. So obesity, as we mentioned, is one of the causes of high blood pressure. And along with obesity, to prevent obesity, we avoid having a sedentary lifestyle. So all of these things together come to the final outcome of allowing you to be able to actually decrease your risk for hypertension, or if you have borderline hypertension, to actually reverse it and bring it back down to normal. We talk about sometimes losing weight. If you lose about 10 to 20 pounds, you can decrease your blood pressure by about 5 to 20 millimeters of mercury. So you can really have a major effect on your blood pressure just by losing weight.
So, and as far as smoking and alcohol go, would you say that,
Right. So, these days, nobody should be smoking, and I'll go on record as saying that, but if you do smoke, then obviously quit. And there are ways to help you quit. There are different medications, and even support groups even will help people quit smoking. So if you do smoke, definitely quit. Alcohol also has different effects where it can raise your heart rate, it can raise blood pressure directly itself, and it can even have negative effects on the vasculature and all those types of organs in the body, the heart, the brain, everything like that, and actually cause high blood pressure. So if you drink excessive alcohol, then of course you need to limit that or stop it altogether.
Yeah. Thank you so much for all the information and all the time and I hope you answered a lot of our viewers' questions, and I know schedule has been tight, but thanks so much for taking time out and being with us and helping us out.
Thanks.
We hope you enjoyed our episode today on our second season of CYC MD. Until next time, God bless.